Low blood pressure, what can be done about it? And what has been clinically proven to be safe, effective, that is also natural? So firstly, what is blood pressure itself? Blood pressure is basically, it's the amount of pressure that the blood puts on the arteries with each heartbeat. So normal blood pressure is considered to be in the range of 120 over 80. That's systolic over diastolic. So that's considered normal. Now, most patients and most people in general develop problems with high blood pressure, but low blood pressure occurs as well as many different things that can cause it. So whenever your blood pressure changes, and those changes seem to be recurrent or consistent over a long period of time, that becomes defined as either hypertension if it's high or hypotension if it's low. And both of those things indicate underlying problems with your health. So, what can actually cause low blood pressure? Let's just talk about that before we get into the remedies. So, there's a bunch of things that can cause it: diabetes, pregnancy, severe loss of blood where you become anemic, dehydration, damage to the actual heart valves itself. Anaphylactic shock can cause it as well. Hypothyroidism, stress, um, old age is also a risk factor for it, and B12 deficiencies. Taking medicines that treat high blood pressure can actually make your blood pressure get too low as well. It won't necessarily give you the diagnosis of hypotension, but it can cause your blood pressure to drop. That's medications like antihypertensives, like beta blockers, and even diuretics. And so, and then not to forget Parkinson's disease. And the only reason this comes to mind is because I deal with a lot of Parkinson's cases. And this is another condition that can cause hypotension, low blood pressure. And then specifically in Parkinson's, I see a lot of the orthostatic hypotension, basically where the patient stands up, the client stands up, and the blood pressure drops drastically. So, what can actually be done about this? If you have this problem, what can be done about it? Well, firstly, you need to address the underlying cause of it. If you're underweight severely, you need to improve that. Otherwise, you're going to be taking medicines to manage it, and that's going to be long term. So if you're underweight, get that under control. If you're severely anemic, fix that. And I have articles on anemia. I'll be doing videos on it too. If you're severely dehydrated, obviously that will be an acute situation. So, and even blood loss as well. Whatever the cause of it is, that's what needs to be addressed firstly. Now, let's talk about some symptomatic remedies. Now, the first thing on this list is rosemary. I know, sounds a little too simple, too easy, right? Now, believe it or not, this simple herb that you find in most people's kitchens has been used in multiple clinical trials for treating multiple different disorders. Not just for low blood pressure, it's also been found to regrow hair. It works in one clinical trial, it was just as effective as minoxidil for improving hair growth. And it's also used for improving memory. There was a clinical trial done on that. I believe there's a clinical trial done for cognitive function as well, but the one that gets me is the one that was used, where it was used for treating hypotension, low blood pressure. So just inhaling rosemary oil, essential oil, can actually improve and increase your blood pressure, which is why it's considered something that's contraindicated for patients who have high blood pressure because it can raise it further. And so that's number one on the list, rosemary. The second thing on this list is holy basil, also known as Tulsi. Now, holy basil has become really popular recently as an adaptogen, which is basically an adaptogenic herb is basically something that helps your body's physiology handle stress better. Basically, when you become stressed out, your blood sugar goes up, your blood pressure goes up, your heart rate goes up, the inflammatory response is triggered really strong. And so what Tulsi does is it helps your body to not do all of those things in a state of stress. And so that's what it's become really popular for, as well as its immune boosting properties. It's able to increase your natural killer cells and your T cells and your interferon gamma specifically. So it has a lot of benefits, but the one thing that's really important is its effects on blood pressure. This has actually been shown somewhat of it's shown to have somewhat of a regulatory effect on blood pressure because it's been used for treating both high blood pressure as well as low blood pressure. And it's also been used for treating blood sugar levels. So it really depends on what's causing your low blood pressure, and that's where you would implement Tulsi. Now, Tulsi is a little bit, this is something that you shouldn't just buy it and take it. Like Rosemary is a little bit safer than Tulsi, in my opinion. You should always use everything under the doctor's supervision. But the reason I say this is because I've seen people misuse holy basil and take too high doses, and sometimes take it in conditions that it wouldn't help. So you got to be careful with Tulsi. But this again is for your information. If you go speak to a physician about it, that'll be better for you. But I know most of you don't listen to me when I say do that. So the third thing in this list is it's related to a specific type of low blood pressure known as postprandial low blood pressure. This is basically where your blood pressure drops after eating a meal. So this can be a real problem, especially when you consider the fact that, well, when you work, you got to take a lunch break. You got to eat, and then if your blood pressure drops straight after that, how are you going to get back to work? That's a problem. And same thing with breakfast. You know, it's time to get to work. You eat breakfast, and your blood pressure drops, and you're dizzy, and you're feeling weak. Really inconvenient. So here's the thing. Again, you need to address the cause of it. I'm going to give you a remedy for it, but this is not a long-term solution, although most people will use it as a long-term solution, which I don't recommend. But you need to find out what is causing it and address that. So the solution, the simple remedy that can help you in this case, believe it or not, is caffeine. Caffeine's been used in a clinical trial for treating postprandial hypotension, and it was found to be quite beneficial. Basically, consuming a caffeine-rich beverage after a meal, which is actually, it actually kind of goes against the principles of health in Ayurvedic medicine. But like I said, this is a temporary solution. So these are some things that can help you. Rosemary, Tulsi, and in the case of postprandial, post-meal low blood pressure, caffeine can help you as well. Now, it's really important to work on your diet as well. For example, if you are anemic, if you've lost a lot of blood, you need to build that up. You may need B12, you may need iron, especially like B12 and pernicious anemia. That's also related to B12 absorption. But it's really important that if you are somebody who's underweight, that you get a good diet. It helps you to build up weight, the right kind of weight, more muscle, and increasing your bone density. And so I would strongly recommend you get into a diet that's nutritious, that's filled with nutrient-dense foods. If you go to my website, there's tons of information on this. I talk about diet in almost every condition that I discuss. But just because I mentioned it here, I'm going to put a list of nutrient-dense foods in the description of this video, and you can look into those. And yeah, that's my take on low blood pressure and a few things that you can do about it. I hope this information has helped you. I'm sure it will. And if you'd like to get in touch with me, I do online video call consultations. You can get all that information on my website, drnishal.com. And I will see you in the next video.